Abnormal behavior is any behavior that deviates significantly from what is considered typical or socially acceptable. In the context of mental health, abnormal behavior can manifest in various ways, often causing distress to the individual or those around them. It is important to understand that abnormal behavior is not necessarily synonymous with mental illness, but it can be a sign of underlying psychological issues or conditions that require attention. In this chapter, we will define abnormal behavior, explore its characteristics, and delve into how abnormal behaviors are assessed in the field of psychology. What is abnormal behavior? Abnormal behavior refers to patterns of behavior, thoughts, or emotions that deviate from the norm, causing significant distress or impairment in functioning. This can manifest as actions, beliefs, or feelings that are significantly different from those observed in the general population. Abnormal behavior often disrupts a person's ability to lead a fulfilling life and maintain relationships, work, or school performance. It's important to note that abnormal behavior is a complex and multifaceted concept. There is no single definition of abnormality that applies universally, and cultural, social, and historical factors all play a role in determining what is considered normal or abnormal behavior. The criteria for defining abnormal behavior. Psychologists and mental health professionals use several criteria to help determine whether a behavior is abnormal. These criteria include 1. Statistical deviation. One way to define abnormal behavior is through statistical deviation, which looks at how far a behavior deviates from the norm. If a behavior is rare or occurs infrequently in the general population, it may be considered abnormal. For example, people who experience hallucinations or delusions are often considered to exhibit abnormal behavior, as these experiences are not common in the general population. However, statistical deviation alone is not a definitive measure of abnormality. Some rare behaviors, such as extraordinary talent or intelligence, are not considered abnormal, even though they deviate from the norm. 2. Social norms and cultural expectations. Social norms and cultural expectations are another important factor in defining abnormal behavior. What is considered normal or abnormal behavior can vary significantly across cultures and societies. For example, certain behaviors, such as public displays of emotion or personal grooming habits, may be considered inappropriate in some cultures but acceptable in others. Behaviors that violate societal rules or cultural norms are often viewed as abnormal. However, cultural relativism suggests that abnormality should be understood within the context of a particular culture and its norms. What is considered abnormal in one culture may be perfectly acceptable in another. 3. Distress or impairment in functioning. Abnormal behavior is often defined by the level of distress it causes the individual or the impairment it creates in their daily functioning. If a person's behavior leads to significant emotional or psychological distress or interferes with their ability to function in social, occupational, or academic settings, it may be considered abnormal. For example, a person experiencing severe anxiety may have difficulty performing everyday tasks, such as going to work, attending school, or maintaining relationships. The distress caused by the anxiety, along with the resulting impairment in functioning, would likely indicate abnormal behavior. 4. Maladaptive behavior. Maladaptive behavior refers to actions or habits that are harmful or counterproductive to an individual's well-being. These behaviors are often associated with mental health disorders and can have negative consequences on an individual's physical, emotional, or social health. For example, substance abuse, eating disorders, or self-harm are considered maladaptive behaviors because they cause harm to the individual and hinder their ability to function in a healthy way. Maladaptive behaviors often develop as coping mechanisms to manage distress, but over time they can become problematic and reinforce unhealthy patterns of thinking and behavior. The role of mental health professionals in identifying abnormal behavior. Mental health professionals play a key role in identifying abnormal behavior and diagnosing mental health conditions. They use various diagnostic tools and assessments to evaluate an individual's behavior, thoughts, and emotions. This process typically involves the following steps. 1. Clinical interviews. Clinical interviews are conducted to gather information about the individual's behavior, emotions, and thoughts. The therapist or mental health professional will ask questions about the person's symptoms, personal history, and current struggles. This allows them to assess whether the individual's behavior aligns with any known patterns of abnormality or psychological disorders. 2. Psychological assessments and tests. In addition to clinical interviews, mental health professionals may use standardized psychological assessments and tests to further evaluate a person's behavior and mental state. These assessments can help identify specific conditions such as depression, anxiety, personality disorders, or schizophrenia. 3. Observation of behavior. Mental health professionals may also observe an individual's behavior in various settings, such as during therapy sessions or in social environments. This observation can provide valuable insight into the person's emotional responses, coping mechanisms, and interactions with others. 4. Diagnostic classification systems. Mental health professionals often rely on diagnostic classification systems, such as the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, to assess and categorize abnormal behavior. The DSM-5 provides a comprehensive list of mental health conditions and their criteria, helping professionals identify specific disorders based on observable symptoms. Common types of abnormal behavior. There are numerous types of abnormal behaviors that may be indicative of mental health disorders. Some of the most common abnormal behaviors include 1. Anxiety and panic attacks. Anxiety is a common emotional response to stress, but when anxiety becomes chronic or overwhelming, it can result in abnormal behavior. Panic attacks, characterized by sudden episodes of intense fear or discomfort, can be debilitating and often cause individuals to avoid certain situations or places. People who experience frequent panic attacks may develop panic disorder, a condition marked by ongoing fear of having another attack. 2. Depressive behavior. Depression is characterized by persistent feelings of sadness, hopelessness, and a lack of interest in daily activities. Abnormal depressive behavior may include withdrawal from social interactions, difficulty concentrating, changes in appetite or sleep patterns, and thoughts of self-harm or suicide. Major depressive disorder is a clinical condition that involves severe and prolonged depressive symptoms. 3. Obsessive compulsive behavior. Obsessive compulsive behavior involves persistent intrusive thoughts, obsessions, and repetitive actions, compulsions, aimed at reducing anxiety. Individuals with obsessive compulsive disorder, OCD, may feel compelled to perform certain rituals or routines to alleviate distress, such as washing hands repeatedly or checking locks multiple times. 4. Mood swings and emotional dysregulation. Mood swings and emotional dysregulation are often seen in individuals with bipolar disorder or borderline personality disorder, BPD. These individuals may experience extreme fluctuations in mood, ranging from periods of intense happiness or energy, mania, to periods of deep sadness or hopelessness, depression. Emotional dysregulation can lead to impulsive behaviors, difficulty in relationships, and problems with self-image. 5. Eating disorders. Eating disorders such as anorexia nervosa, bulimia nervosa, and binge eating disorder involve abnormal patterns of eating, often driven by distorted body image or emotional distress. These disorders can result in serious health complications and are associated with significant psychological distress. 6. Psychotic behavior. Psychotic behavior is characterized by a loss of touch with reality. Individuals experiencing psychosis may exhibit symptoms such as delusions, false beliefs, and hallucinations, sensory experiences that are not based in reality. Psychotic disorders, such as schizophrenia, often involve significant cognitive and emotional disturbances. 7. Personality disorders. Personality disorders involve enduring patterns of behavior, thoughts, and emotions that deviate significantly from societal expectations. These disorders can affect relationships, work, and overall functioning. Common personality disorders include antisocial personality disorder, narcissistic personality disorder, and avoidant personality disorder. Reflection exercise, identifying abnormal behavior. Reflect on the following questions in your journal. Have you or someone you know experienced any abnormal behaviors or symptoms that cause distress or impairment? What were the potential underlying causes of these behaviors? Were they related to stress, trauma, or mental health conditions? How might understanding abnormal behavior help you better support yourself or others who may be struggling? What steps can be taken to address abnormal behavior, either through self-care or professional support? Conclusion. Understanding abnormal behavior. Abnormal behavior is a complex and multifaceted concept that involves deviations from typical patterns of thinking, feeling, and behaving. While abnormal behavior is not always indicative of mental illness, it can be a sign of underlying psychological issues that require attention and intervention. By understanding the criteria for abnormal behavior, the role of mental health professionals, and the types of disorders that may be involved, individuals can better recognize and address abnormal behaviors in themselves and others. In the next chapter, we will explore the process of personality formation and how distortions in personality development can contribute to the emergence of personality disorders. Stay tuned for more insights into how our experiences shape who we are and how mental health challenges can be addressed.